So let's talk a bit now about phytocannabinoids and their use in epilepsy and what the data really shows around the use of these products in patients. So first thing that's important to know is that this research is very much in its infancy. Because of prohibition, because of many of the stigmas associated with cannabis, a lot of this research has been delayed by decades and is a lot further behind than it should be. And so the studies that are out there at the moment are very early stage. There's very few of them, and so we have to be very careful when we generalize the findings of these studies. So in this study, they looked at the efficacy of phytocannabinoids in 10 patients suffering from intractable epilepsy. Now, they did see some pretty incredible reductions in the frequency of seizures in some of these patients. When we're talking about hundreds, nearly thousands of seizures a month, reducing that down by 50%, 20% is remarkable. But some of these patients saw reductions in their seizure frequency by as much as 86% once they started using phytocannabinoids to intertwine and start nudging that endocannabinoid system in these patients. The contents of these products was pretty variable and pretty unknown, but typically there was a full broad spectrum of phytocannabinoids within those compounds. Now, unfortunately, these families were having to fund these prescriptions and these medicines themselves. This, unfortunately, in the UK is only accessible via private medicine. There are just 3 patients, to my knowledge, who are having these paid for by the NHS, and that's leaving thousands of patients unable to access these medicines, due to the cost prohibitive nature of those. And so you can see that £800 a month plus, and in some cases I've heard these prices cost go up to £4,000 a month, depending on the patient, the size of the patient, the age of the patient, depending on how their body has adapted to these compounds. Everyone's going to have a different degree of susceptibility to these compounds, and as well, everyone's body's going to absorb these in different ways. Some may be more responsive than others, and that is because of their endocannabinoid systems and their other biological processes that are going to be affected by a number of factors throughout their body. It might be other medicines they're taking, and it could also be the diets that they're consuming as well. So as you can see, these are some pretty remarkable outcomes that were seen in this study conducted by Drug Science, but this is just in 10 patients, and so would the differences be greater in a 100-person study? Would it be different, smaller, greater in a study of 1,000 people? It's hard to say, and so we have to be really careful when we generalize data of this kind. But as we've seen in this snapshot here of 10 patients, an 86% seizure frequency reduction is life-changing and may even potentially be life-saving for these patients too. And so there are now a number of children that have successfully pretty much, I hate to say cured their epilepsy, but they haven't had a seizure in a very long time. And as a result, they're living happier, healthier lives now than they were previous to taking cannabinoid medicines. Now, there is a caveat to this in understanding the potential risks associated with these compounds as well. If mixed with the wrong medications, that can potentially have toxic effects on the body as well. And what we do see are a number of side effects from this mixing of medicines and from this mixing of compounds, just because of how many drugs and different medicines are interacting in the body, pushing different buttons and altering the body in different ways, sometimes conflicting ways, sometimes synergistic ways. But crucially, these things can go either way, and so there's always an element of risk to these compounds, whether we're aware of them or not. The most important thing is that we're controlling all the variables that we can and aware of all of the potential variables that are affecting the patient and the success of these medicines as well.